Hi, it's Rotator from Acupuncture Nerds. In this video, I'm going to share excellent techniques you can do at home to ease pain or even increase the range of motion from your frozen shoulder. A frozen shoulder is a condition where the shoulder joint becomes stiff and painful to move. The symptoms usually develop gradually and can worsen over time. It is caused by a thickening and tightening of the shoulder joint capsule, which can significantly limit the range of motion and cause pain when you move your shoulder, like picking up a cup over the shelf, combing your hair, or reaching up your bra hook. Massage techniques that I use is called trigger point massage, which targets specific points in the muscle. These trigger points can be felt as small lumps, typically no larger than pea. When pressed, a trigger point can be feels like it's tender or sore, and the taut band may be present in the muscle, which feels like a cord or a small cable and extended from the trigger point to its attachments. This taut band can be limit your range of motion and cause stiffness in your shoulder, ultimately leading to a frozen shoulder. So I created an easy 9-step you can do at home to improve your range of motion and reduce the pain, and hopefully you can use your shoulder more freely. So what is a frozen shoulders? Frozen shoulder, also known as glenohumeral capsulitis, occurs when the synovial fluid inside the shoulder capsule thickens, causing a loss of flexibility in the shoulder joint. Synovial fluid is a liquid that is present in every joint and tendon. It helps to reduce frictions and inflammation when you move your joints. And who has more risk of suffering from frozen shoulder? There are several risk factors that can increase the likelihood of developing frozen shoulder. Some of these factors include a history of shoulder injury or surgery, diabetes, thyroid disorders, heart disease, Parkinson's disease, and stroke. And people who are over the age of 40 and women are more likely to develop frozen shoulder. There are 3 stages: freezing, frozen, and thawing. Number 1, freezing stage. This is the initial stage where you start to feel pain and stiffness in your shoulder. Pain gradually increases over time and you may find it difficult to move your shoulder. This stage usually lasts for 6 to 9 months. And number 2, frozen stage. In this stage, the pain starts to subside, but the stiffness remains. And you may find it difficult to carry out everyday activities like combing your hair or reaching behind your back. And these stages usually last for 4 to 6 months. Number 3, thawing stage. In this stage, the stiffness gradually reduces and you start to regain your range of motion. This stage can last for 6 months to 2 years. How to massage your frozen shoulder by yourself? There are 8 steps of massages you can do to release the tension of the specific muscle and loosen up the joint capsules to increase the range of motion. Step 1, rotator cuff massage. There are 4 small but essential muscles around your shoulder called rotator cuff. These muscles mainly help in moving your shoulder outward as external rotators. According to theories, these muscles have an agonist-antagonist relationship. If the rotator cuff muscles are weak or tight, there can be an imbalance in the internal and external rotators of your shoulder, leading to a curved shoulder and a decrease in range of motion. For example, when you lift your shoulder, once it passed 90 degrees, your upper arm external rotate to widen the joint, allow you to lift higher. But if you have a tight in your rotator cuff, the humeral head becomes stuck in the joint, resulting in limited mobility. This can eventually cause a frozen shoulder because the joint capsule tends to tighten up easily with less movement. For example, after having a cast in your broken fingers for a month, and you might have felt stiff or limited joint movement after the cast was removed. This occurs because the tightening of the joint capsule due to lack of movement. This same thing will happen when the shoulder joint goes inward too much or for a long time. To prevent or manage that, you need to massage and release the rotator cuffs. There are 3 spots on the back of your shoulder. To locate the first spot, place your thumb and the index web on the armpit and extend it to your arm. The first spot is located at the tip of your middle finger. Use your 3 fingers to point towards the outside of your shoulder and massage in circular motion for 10 seconds. The second spot is just below the first spot. Find the tender spot or taut band and rub a circular motion for 10 seconds. The third spot is below the second spot. You should feel the edge of your wing bone, also called the scapula. Rub the circular motion for 10 seconds and repeat this entire cycle 2 more times. Step 2. Armpit massage. This area can be quite sensitive for people who suffer from frozen shoulders. Massage techniques I've been using is specifically for serratus anterior muscles, which is connected to your ribs and wing bone. When you lift your shoulder, it's not just your shoulder joint that moves, but also your wing bone. Once your shoulder is lifted beyond the 30 degrees, your wing bones start to move outward. But if you experience a frozen shoulder, you might lose this movement due to a tightening of your serratus anterior muscle. Massage the area below your armpit using 2 to 3 fingers. Find the 2 to 3 tender spot and massage sideways for 10 seconds before you moving on to the next spot. Repeat this cycle 2 more times. Step 3. Neck massage. A stiff neck can be also aggravate the movement of your shoulder, and you need to release it before you feel release your shoulder. The next muscle is the scalene. These muscles often affect your neck bundle nerves, which is also called brachial plexus. People who have a frontal shoulder pain really needs to release these muscles because these nerves control them. To give a neck massage, use 3 fingers to start just below your earlobe. Divide the area into 3 spots and work your way down until you reach just above your collarbone. Use a circular motion and apply a little bit of pressure for 10 seconds. Be careful not to apply too much pressure and cause pain. Gentle massage is enough to feel good. Move down towards your collarbone and repeat this cycle 2 more times. And step 4, collarbone massage. The next spot is located just below the collarbone. If you experience a tenderness when you touch here, it may be due to tightness in your pec major muscle or subclavius muscle. These muscles can cause the pressure on the nerves and vessels in the area. To alleviate this, please rub sideways along the collarbone for 10 seconds and repeat this cycle 2 more times. And step 5, shoulder massage. The next step is located on the shoulder. Touch the inside of your shoulder where there is a depression. Inside the depression, you'll find a bone called the coracoid process. This is where the coracoid brachialis and the pec minor muscles attached. When these muscles becomes tight, your shoulder may roll inward because of frozen shoulder. To loosen up this point, use your fingers and place them just inside the knot. Rub in the circular motion for 10 seconds. You may feel sore at this point, but that's normal. Repeat this process 2 more times. There are trigger points on your upper arm because the biceps, triceps, and coracoid brachialis are also attached to the scapula. You need to massage your upper arm. There are 3 spots: inside, middle, and outside of your upper arm. And when you look at the upper arm, you can find the deltoid muscle, which is located on your shoulder. At the junction of your deltoid muscle, there are 3 spots. The inner spot is located on the frontal side, and you can find a depression between biceps and deltoid muscles. Once you located the spot, you can start massaging it sideways for 10 seconds. The middle spot on your upper arm is located at the point where the deltoid muscle is attached. You can easily identify it by touching your shoulder and find the depression at the center of your upper arm. Once you have located the spot, You can rub it sideways for about 10 seconds. The outer spot is located at the back of your upper arm, between the triceps and the deltoid. If you move your finger from the middle spot outward, you can find another depression at the back of your upper arm. Once you locate it, start rubbing sideways for 10 seconds and repeat this cycle 2 more times. Step 7. Elbow massage. There is an insertion of the biceps muscle at the forearm, and most likely you can find the tender and trigger spot there if you have a frozen shoulder. And first, locate the elbow crease. At the end of the outer crease, you will find the 2 trigger spots. To massage the first spot, straighten your forearm and place your thumb at the end of the elbow crease. Massage sideways for 10 seconds. For second spot, place your thumb between the elbow crease and the elbow bone, also called lateral epicondyle, and rotate your arm inward. Press and rub sideways for 10 seconds. Repeat this cycle 2 more times. Step 8. Hand massage. In this step, I will introduce you to the beneficial acupressure point called Li4, also known as a Gokoku in Japanese, which is often used in the licensed acupuncturist to treat frozen shoulders. To find the points, you press the 4 spots along the second bone. Find the most painful or tender spot in 1 to 4. Once you find it, rub the circular motion for 10 seconds. Another acupressure point located on the outside of your hand is called SI3 or koke in Japanese. You can find this spot by pressing the edge of the bone and identify the most painful tender spot. Once you find it located, rub the spot in a circular motion for approximately 10 seconds. Repeat this cycle 2 more times. Step 9. Heat therapy. After you have done these 8 steps of a frozen shoulder massage exercises, I would recommend you to apply a heat pack or heat lamp on your neck and shoulder. Near-infrared heat therapy is a type of therapy that uses light to generate heat in the body's tissues. It involves the use of the device that emit near-infrared light, which penetrate the skin and is absorbed by the body's cells and tissues. This absorbed light energy is then converted into heat and speed up the tissue recovery. In one study that investigated the use of the heat therapy to treat frozen shoulders, the study shows that treating with the near-infrared light can reduce the pain and improve the range of motion for several years after treatment. Applying a heat pack can be beneficial in loosening up the muscles, increase the blood flow, and soften the tissue, which can help to improve the range of motion and reduce the pain. For example, you can use the heat pack especially designed for the neck. Additionally, you can place the pack inside your cloth and apply it directly to your shoulder for additional relief. Performing these massage techniques on a regular basis can help speed up your healing process and avoid the need for steroid shots or surgery. But if you still have trouble with your shoulder movement, you might want to consider alternative treatments like acupuncture before you decide on the painful injections or surgery. I hope you and your loved one can get better from frozen shoulders soon. Thank you for watching and see you in my next video. Take care. Bye.